Hi, I'm Anne Riddell. Science and You starts now.
I'm Donna Hanover. These new mannequins are training medical personnel in New York to move more precisely and more swiftly when lives are on the line. That's ahead on Science and You.
I'm Anne Riddell. We all know exercise is good for our bodies, but what about our brains? That's ahead on Science and You.
I'm Magalie Laguerre-Wilkinson. Health experts consider obesity to be the most serious medical problem afflicting the U.S. today. What's even more alarming is the increasing rate of obesity among children. What to do? The answer coming up on Science and You.
I'm Mike Gilliam. Stress is something a lot of people are dealing with these days. But how do you recognize when it's becoming a problem, and how do you deal with it? We'll find out in just a minute on Science and You.
How many times have you celebrated your 29th birthday? I'm Ernabel Demillo. Coming up, I'll have all the latest advancements in cosmetic technology that will fight the aging process. That's all ahead on Science and You.
I'm Donna Hanover. There's a new medical simulation center in New York that was conceived shortly after the 9/11 attacks. The idea is to make sure that medical personnel can be ready for any catastrophe.
I'm clear, you're clear, everyone clear?
We're all clear.
Tracking patient now.
Let's stop and do a pulse check.
I'm going to intubate the patient.
Okay. Do we have a pulse?
A collaboration between the City University of New York and NYU Langone Medical Center, and located at Bellevue Hospital, the Simulation Center has mannequins that can replicate many life processes, like breathing and blinking, and remarkably realistic injuries. Dr. Heather Mahoney is on duty as the ER supervisor. So what's wrong with this guy? What happened to him?
So this gentleman here is a patient who got hit by some flying debris during Hurricane Irene and has sustained some head trauma. So the patients are going to have to the residents are going to have to resuscitate the patient and possibly intubate due to the head trauma.
What is the value of having a mannequin like this, which is very costly? What is the value to medical personnel?
Well, this helps simulate the actual hospital environment and increase the stress of the residents as they're trying to learn, help them actually take care of patients safer when they actually do encounter them in the emergency department for the first time.
I would think this would actually take down the level of stress, since you know you actually can't kill this mannequin.
Well, when you have the beeping monitors, the actual real-life scenario looking like a patient, it actually brings up that stress level and makes it seem more real.
So having that adrenaline pumping is part of what actually happens to a doctor in an ER.
Exactly, and it helps reinforce the teaching points.
There are child mannequins to improve training for their specific needs.
EMS, what's the story here?
We've got a 7-year-old male patient post-cardiac arrest.
And actors are sometimes hired so doctors can practice getting information from frantic parents.
Son, Rudy.
The father has
Rudy,
arrived.
please.
Dr. Hamilton, please speak with the father.
Somebody tell me something. What's going on?
Giselle, let's prepare for fluid bolus,
Rudy,
20
that's my
cc per
son's name.
kilogram.
What happened? I don't know.
Let's continue bagging the patient.
In another area of the facility, there are specialty pieces that allow doctors to deal with just hands or faces. There's also an intensive care unit, and there are operating rooms. Dr. Andrew Rosenberg, the executive vice chair of the Department of Anesthesia at NYU Langone Medical Center, is supervising an emergency C-section. Will you be able to use the mannequins to show things that can go wrong?
Actually, the beauty of these mannequins is the advanced physiology of them enables you to make certain changes on them to make them more difficult to ventilate, more difficult to intubate. You can change the blood pressure parameters, the oxygenation, the saturations, and then have the people react to that and see how they react. And then when you debrief them afterwards, explain to them what you think should have happened, what they should have been doing, and that way people can actually learn how to behave in those situations.
The Simulation Center will be used to train not only doctors, but paramedics, nurses, and other medical personnel. On the first day it opened, CUNY Chancellor Matthew Goldstein explained that the center is a spectacular step forward in making sure first responders and other medical professionals are ready for any crisis.
And I think a facility like this will prepare our people to be nimble and effective, forward-thinking, and aggressive as they confront challenges that inevitably are going to occur.
The most complex of the mannequins cost more than $200,000, but they are expected to have a tremendous impact on healthcare for decades to come. Some supporters present for the Simulation Center's opening day were reminded that in traditional medical education, disciplines rarely train together.
The first time that they will come together to work as a team to take care of patients is really in the healthcare setting.
The idea here is to change that. The C-section is a great example of training between a surgical team, an anesthesia team, and a pediatric team.
Yes, so Dr. Lerner, this patient does not have an epidural in place. We're going to have to do general anesthesia. Because of our habitus, we're going to anticipate a difficult intubation.
Good crically pressure.
Ma'am, you're going to go to sleep, okay?
I'm having difficulty visualizing the course. There's a lot of redundant soft tissue.
I'm going to go ahead and take a look with a glide scope since it has a camera.
Okay, glide scope's in. Place the reports on the screen too, please. Patient's connected. We have end-tidal CO2. We're in. Can make incision.
Great skin incision. Doctor, please. Next is uterine. Table down. This is breech. How's the mom doing?
She's doing well. Her vitals are stable.
Please, how's the baby? Baby is crying.
These simulation mannequins are known as Sim Man, or in this case, Sim Woman, since she just had an emergency C-section. Afterwards, the medical personnel can review video shot from cameras above to make sure they've given the best care possible. I'm Donna Hanover for Science and You.
I'm Anne Riddell. For years, we've been told exercise is good for us, good for our waistlines, and good for our hearts. Now studies suggest it may be important to keep our brains moving as well. But can mental fitness influence outcomes in the battle against Alzheimer's disease? It's a question scientists are studying. Today, we'll show you what some seniors are doing to keep their minds active. She is well into her 70s, but age has not dulled Ola's sense of humor, not one bit.
And how old are you? How young are you?
I'm old enough to know better.
Ola is a regular at New York Memory Center in Brooklyn. It's a chance to chat, socialize, and, she says, hopefully keep her mind active in the battle against Alzheimer's.
I do have a memory problem. I call it Alzheimer's, but now it's got to be 3/4. Now it's Alzheimer's.
But beneath the joking lies a deep sense of frustration. Ola, a former teacher at Medgar Evers College, says at times she struggles to remember what she once took for granted.
Sometimes my daughter will she'll tell me something, and then, later on she'll say, well, Mommy, she'll be talking about it, and I said, I don't remember that. I fancy myself as knowing a lot of stuff. I do know a lot of stuff, but I forget, And if I don't mark the days off the calendar every day when I get up, I don't know what day it is sometimes,
Ola is far from alone. It's estimated about 5 million Americans may have Alzheimer's disease, and research suggests the prevalence of the disease doubles every 5 years beyond age 65. Now consider this. The number of people age 65 and older is expected to more than double between 2010 and 2050. As Dr. Nancy Foldy of Queens College says, the biggest predictor of the illness is age.
So is it reasonable to assume or believe that as the population grows older and lives longer, we're going to have more and more and more?
Cognitive training, essentially exercising the brain, has gotten a lot of attention as a potential way to help slow the progression of Alzheimer's disease. Here, Ola is trying to build her skills through a specialized computer game.
Ringling Brothers Run.
The seniors here also answer trivia questions and use music to rev up both their bodies and minds. But can activities like these really make a difference for Alzheimer's patients? Though scientific research is underway, experts say the evidence at this point is not definitive.
We want a panacea. We want a pill that says, don't let me have this. I think there's enough suggestion, and it's really a suggestion, that the healthier you are, the healthier your brain can be. And you just hope that that has something to do with it.
But it is not conclusive.
It's not conclusive. You can't say, because I do that crossword puzzle Monday through Saturday and Sunday, I'm going to prevent getting Alzheimer's disease. That's not going to happen.
So what are the absolutes of Alzheimer's? Sadly, very often one of them is the heartbreak, not only for patients, but for their families.
How would you describe what this is like for people who maybe don't have firsthand experience with it?
I think some of this is worse than death, because it's watching somebody whom you love slowly deteriorate, of who the person is, not just the body, you know, to see somebody just slip away.
Despite what the research proves or doesn't prove, the director at New York Memory Center says he sees benefits cognitively and socially for the seniors here, and Ola is staying feisty in the face of this dreaded disease.
So I tell people, you know, I have CRS. Can I say this? Can't remember.
Though the research is still unclear, scientists are learning more about the possible benefits of exercising our brains and staying mentally fit. And that's something to think about. I'm Anne Riddell for Science and You.
I'm Magalie Laguerre-Wilkinson. Did you know that over 60 illnesses, from heart attack and strokes to certain cancers and diabetes, are linked to obesity? Even losing a small amount of weight through diet and physical activity can significantly lower your risks.
For perhaps the first time ever, more focus is on eating healthier, exercising more, and losing weight, especially among children. Much of the attention can be credited to First Lady Michelle Obama's anti-obesity campaign. But the medical community is also paying attention. Dr. Louis Aroney, the director of the Comprehensive Weight Loss Program at New York Presbyterian Cornell Medical Center, is an internist specializing in obesity.
If this were an infection, we would have resources mobilized like you would not believe. But because it's a problem that has to do with body weight, what people seem to do is to blame people who have the problem. When I graduated from medical school, obesity was not even considered a medical problem. We now understand that there's a problem with communication between the fat cell and the brain. The brain can't tell how much fat is stored and is resistant to this hormone called leptin. So that's what's causing the obesity epidemic.
Dr. Aroney can't wave a magic wand to cure this epidemic, but under the right circumstances, he would even support gastric bypass surgery if all else failed. However, he does feel there's a healthier and safer solution.
Lifestyle change is the foundation of treatment. So you need to change what you're doing in order to succeed. There's no question. At a larger level, at the government level, why don't we subsidize fruits and vegetables? Why are we subsidizing foods that cause obesity in the middle of an obesity epidemic?
William Williamson had tried everything without success until he became one of Dr. Aroney's patients.
Get your mind right. You have to get it that you want to get this done. You want to be healthy. You can't just say you want to do it, don't do it. It's not going to work. You have to sit there and say, listen, like you make peace with yourself, you want to make peace with God, make peace with your body. Let's say I started seeing Dr. Aroney, my weight was maybe, let's say 350, somewhere around there. I'm 293 pounds right now.
Fear also helped William shed the pounds. Like millions of overweight Americans, his overall health also suffered.
My problem was drinking sweet teas, soda. I was drinking like 2 gallons of sweet tea every day, green tea with honey or Arizona sweet tea. And this is where all the weight was coming. I was diagnosed with type 2 diabetes. I was 366 pounds at that time. Okay, I didn't realize why I kept putting this weight on. I had congestive heart failure. I was diagnosed with congestive heart failure. I have asthma. I have sleep apnea. But this is all due to obesity. Everything works hand in hand.
What does your treatment involve?
My treatment involves me looking in my mirror and smiling and saying, William, you're looking better every day. William is getting better. I'm walking faster. I'm walking further. I ride my bike. I don't jog. It's not good for my knees, so I don't do it. I go to the gym. I get on ellipticals. I do my medication like I'm supposed to do. I eat plenty of salads. Plenty of salads. A lot of water. No sugar in my... Unless it's sugar in something, there's no sugar. I threw all my sugar. I threw ice pops. There's no candies. There's no syrup. I have sugar-free syrups, but people don't know. You will never know the difference on a sugar-free syrup from if you bought Miss Butterworth. People are just, sugar is the devil.
As William continues to shed the pounds, Dr. Aroni continues his crusade.
The appearance of adult type or type 2 diabetes in children, we think, is a very grave sign, really worrisome sign that something terrible is going on in the metabolism of children. We really need to make a massive effort, and it's got to start very early in childhood, because the evidence is that once obesity starts, it picks up steam.
Are there things that you see if you walk down the street that you could say, if I'd eliminated this, 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 and that, I would already find a cure to the problem?
Well, everything from having sodas and juices sold in school vending machines to other very simple methods that could make it more difficult for people to get at calories.
What's the advice for weight loss?
Eat your vegetables first. That's my advice. So what I'm saying is that when we look at trying to cut down on food intake, I think that there are some nuances to this. There are some ways that you can do it that make it easier than just trying to eat less food. Eating protein for breakfast, that seems to help you to eat less later in the day. So we look at simple ways like that that would tend to sort of be natural appetite suppressants that I think help to keep people's appetite in control.
While we live in a society where weight loss is wished upon through any means, the truth is there's no fairy godmother. It's just simply about commitment. As for the children, something as simple as eliminating juices and sodas from schools is a significant step in stopping this epidemic. I'm Magalie Laguerre-Wilkinson for Science and You.
The percentage of obese people in the United States has almost tripled since 1960.
I'm Mike Gilliam. You hear the phrase all the time, I'm stressed out. So tell me, people, what's stressing you out? Maybe we can fix it.
I guess what stresses me out the most are economic factors, both personal and on a global scale and a national scale.
My work takes up 90% of my time, and then I have 10% left for my friends, family, myself, sleep, and food shopping and laundry and all that.
What are the things that stress you out?
Trying to accommodate over 116 people at the same time, and sometimes some things just don't work.
So what is stress?
Stress is basically the physical and psychological response of our body to changing conditions, be it real or perceived.
Different things stress us out, but one thing is certain. At this point in time, stress is on the rise. In fact, according to the American Stress Institute, at least 10% of the population reports suffering from stress. Dr. Nicole Eldon is a psychologist at the Wellness Center in the CUNY Graduate Center. She says stress isn't always bad.
Stress is, it can be positive and it can be negative, right? When it starts to venture into the negative realm, when it starts to disrupt the functioning of the individual in their lives, then it can become more of an anxiety and sometimes a depression. But there is also, stress can be positive. There could be a part of stress that enables us to function better in our lives. For example, it gives us higher endurance to do things, more motivation to do things, and it helps us achieve. So stress can be positive and negative. Anxiety often is disruptive.
Graduate student Aisha Rahim says she feels stressed.
I feel anxious a lot. I feel like I don't have time for myself. I don't have time to just think or just be in a moment. I'm just always busy thinking about the next thing I have to do. I just never have time to relax. I never feel rested.
So you're stressed?
Yes.
But there are many other symptoms of stress.
You would have disturbances in your sleep. You would have disturbances in your appetite. You would more than likely have issues with regards to concentrating and paying attention to the tasks that you are doing. Different somatic issues going on in your body, and it depends on you what that might be. It could be headaches, backaches. You might have muscle tension. You might have a feeling of chronic worry and anxiety, ruminating about something over and over.
Other symptoms include rapid heartbeat and trouble breathing, moodiness, irritability, or sleeping too much. And Dr. Eldon warns the symptoms could be different for everyone. But no one has to live a stressed out life. Bottom line, I'm stressed out. What should I do?
Figure out what's causing the stress in your environment internally. Figure out the coping strategies you've used and use them again. If it's not working, use them more than you have in the past. If those are not working, look around you for support systems and see whether others have different ideas. And if that doesn't work, seek out a mental health professional who can sit down with you and help you figure out the best way to balance your system so that the stress gets reduced.
So, if you're feeling stressed, take a deep breath and then figure out a strategy for dealing with it. I'm Mike Gilliam for Science and You.
1/4 of all employees in the United States view their jobs as the #1 stressor in their lives.
Hi, I'm Ernabel Demillo. Imagine staying 29 forever. Well, doctors around the country are already pressing the pause button when it comes to aging, including doctors here at this medical spa in Livingston, New Jersey.
From lasers to ultrasounds, we no longer have to look old. It seems CUNY professor Michio Kaku was right on track in his book, Physics of the Future, How Science Will Shape Human Destiny and Our Daily Life by 2100. He writes that one day we will live to 150, but still look 30.
So our grandkids, for example, may have the option of when they hit 30 of simply staying at age 30.
Basically, essentially pushing the pause button.
Yeah, they may want to cruise at age 30 for quite a while, because who wants to live forever but be old?
I think someday that's going to happen, but I think that's going to require a lot more than lasers.
See the spot there?
Kaku's prediction may still be a ways off, but physicians like Dr. Mitchell Chasen have found a way to make 60 look like 45 and 45 look like 35.
Not only are we pausing the aging process, we're actually reversing the aging process. We understand more of the factors that cause aging. And generally in the skin, they're related to sun exposure, heredity, and the environment.
And that's what 58-year-old Barbara Bailey would like to do, reverse years of skin damage and aging.
I think it's a wonderful thing as long as you don't do too much. I think you have to be a little careful because, you know, we can all get carried away. But I think to reverse the aging process to a point is a wonderful thing.
That's the bone right there.
Americans want to look young. According to the American Society for Aesthetic Plastic Surgery, close to 10 million cosmetic procedures were performed in 2010. And while the numbers are going up, the patients are getting younger. Jana Wright just turned 30 and is already having treatments done to stay youthful.
It just made sense for me. I'm healthy in so many other ways. Why wouldn't I do that? And if I can pause it or at least slow it down dramatically, I would like to.
And it is science that has changed the landscape of cosmetic surgery. Powerful and smarter lasers mean less downtime and fewer complications. First came Fraxel, a laser that uses fractional energy to treat skin cells at any one point. The newest device is called E-Prime, which literally reinflates sunken, hollow skin while tightening it. For the first time ever, doctors can deliver laser energy exactly where they want it.
Most laser technologies are delivered through the skin. The problem with that is that we may lose some of the energy as the energy is transmitted through the skin. We also have to worry about damaging the surface of the skin. The E-Prime, we're delivering the energy directly into the deep layers of the skin. And not only are we delivering the energy exactly where we want it, but the computer is assessing how much energy, what temperature we have deep down in the skin, and it's feeding back and making changes, and that leads to safety.
We may not have found the fountain of youth, but thanks to science, we seem to be getting closer.
I don't know about you, but I'm feeling younger already. I'm Ernabel Demillo for Science and You.
That's our show for today. Thanks for joining us. I'm Anne Riddell. See you next time on Science and You.